Hi, my name is T.Lawson. I am doing a presentation on psychosis. I am an Auburn University MSN nurse practitioner student. Psychosis, frightening and confusing. Risk factors for psychosis include genetics. It can also be triggered by an illness. It can also be triggered by alcohol, substance abuse. It can be triggered by someone having schizophrenia, depression, medical problems, delirium, dementia, and also bipolar, schizoaffective. You can also have psychosis if someone's been hospitalized for an exceeding amount of time. They will start to have racing thoughts. They will start to think that people's trying to harm them, that we're trying to keep them caged. That's when you go and get family members to come to the bedside to reassure them that everything will be okay. Three key questions that you would ask someone that comes into the facility that you think is having some type of psychosis. Are they having thoughts of self-harm or suicide? If yes, do you ask them about their plan? What do they plan to do if they want to commit suicide? And the third thing you would do is you would seek medical attention if this person was to say, yes, they are having suicidal thoughts and they do want to kill themselves, and this is how they'll go about. And the third thing, if they're not suicidal, you would ask them, what has led them up to being stressful to have this break in their life, such as the psychosis. 3 physical assessments you would do would definitely be a mental exam to see where their mental thoughts are and what's compromised. You will also assess their behavior, their thought process, their thought blocking literacy response. You will also see if they had a flag affect. You will also check their negative symptoms to suicide withdrawal, check their poverty status. And the other thing, you also listen to their heart, you'll listen to their lung, you'll assess their nutrition, because most people that are psychosis will not eat, they will not drink, they will not sleep, because their reality is completely turned upside down. You will also develop a plan with your team to help reduce them from going into a psychotic episode. You can develop a team with case management, family support. This is treatment. You can also do psychotherapy, medication therapy. You can do any psychotic medications, what best suits that person, that patient for that certain situation. You can also do support education and peer support. Also, the outcomes are usually pretty good once the patient initiates some type of treatment to see what causes the psychosis, to try to reduce that effect, to get them back to pre-functioning state. Also, another part of physical assessment that I forgot to mention, some people suffer from psychosis if it's due to, like I said, an illness, alcohol. So you can check some labs. You can check a CBC. You can check a CMP, liver function, thyroid. You can also check HIV, ANA, SAID rate, vitamin B, to see if something's deficient that's throwing them into some type of psychosis. Most of the outcomes, if caught early in time, the psychosis can be hindered, which will reduce their risks of having any type of self-harm, and try to put them with a supportive group to get them back to their regular norm. Also, 3 teaching methods you would do about prevention, try to redirect them from feeling suicidal or psychosis. The third thing you would do to encourage family support, encourage them with community resources to reduce that extra stress on their lives. And the third thing, you would give them the 1-800 number to any type of supportive care line that can help talk them through any type of crisis that they may have. The National Alliance of Mental Health Illness has plenty of different avenues that they can take to reduce their risk of developing psychosis. Thank you.